Welcome to Science Force, where science comes alive.
Hello, and a very warm welcome to you all. I am absolutely thrilled to have you join me for today's explainer. We are going to be taking a truly fascinating journey from mystery to mastery, looking into a condition that has baffled so many, yet is beautifully understood by modern science. So, whether you're just a curious learner, a life science enthusiast, or a medical student brushing up on your clinical pearls, we're going to unpack the incredible mechanics of Bell's palsy together. We'll move step by step through its vibrant anatomy and its clinical realities. Let's dive right in, shall we? The experience. Now, I want you to just imagine this for a second. You wake up, you stretch, you stroll into the bathroom, and as you look into the mirror to brush your teeth, you realize something absolutely terrifying. Half of your face simply refuses to move. You try to smile, but only one side responds. You try to blink, but one eye just stays wide open. It is a moment of sheer panic. This sudden reality of facial paralysis is exactly what thousands of people experience every single year. But as you'll see today, while it looks incredibly alarming on the surface, understanding the actual science behind it brings a tremendous amount of comfort. The roadmap. To make sure we grasp this completely, here is our quick roadmap for the explainer. First, we'll examine the sudden facial paralysis. Second, we'll map out the facial nerve anatomy. Third, we'll cover how to distinguish this from a stroke. Fourth, we'll look at diagnosis and effective treatments. And finally, the recovery and long-term outlook. Section 1. Sudden facial paralysis. Okay, let's dive straight into Section 1, the sudden facial paralysis. For the medical students tuning in, you probably know this one quite well. Bell's palsy is a sudden, typically temporary weakness or even complete paralysis of the muscles on one side of the face. Fundamentally, it's caused by a dysfunction of cranial nerve 7. And for a general audience, it's actually really interesting to note that this condition gets its name from Sir Charles Bell. He was a brilliant Scottish surgeon from the 19th century who first mapped out the facial nerve and all of its complex functions. Even today, it remains the absolute most common cause of sudden facial paralysis. Key symptoms. When this strikes, the symptoms are incredibly varied. You'll notice drooping on one side of the face and an inability to smile properly. The forehead wrinkles on the affected side go completely flat, and because the mouth droops, patients often struggle with drooling and have a hard time just drinking fluids. But it goes a lot deeper than just the muscles. Patients frequently report a loss of taste on the front 2/3 of their tongue, and wonderfully strange symptoms like hyperacusis, which is this intense, almost painful sensitivity to sound in one ear. And because that paralyzed side loses all its natural muscle tone, the face often appears noticeably pulled toward the healthy, active side. Section 2. Facial nerve anatomy. So, to understand why these specific wide-ranging symptoms happen, we really need to visit the anatomical crime scene. Let's look beneath the skin in Section 2, Facial Nerve Anatomy. It is absolutely brilliant to realize just how hard cranial nerve 7 works for us every single day. I mean, it is not just about smiling or frowning. This single vital nerve controls our ability to close our eyelids. It stimulates tear production to keep our eyes properly moist. It transmits taste sensation from the front 2/3 of our tongue, and it even commands our saliva secretion. When you consider this huge list of functions, it makes perfect sense why injury to this one specific nerve causes such widespread chaos, from a dry eye all the way down to a loss of taste. But this brings us to a really profound question. How exactly does a simple virus, something as common as a cold sore virus, manage to completely paralyze half of a human face? Well, for our life science students, here's the rigorous mechanical breakdown. First, a viral infection or some form of inflammation occurs. In response to that, the facial nerve swells up. Now here's the critical anatomical bottleneck. This nerve has to pass through a highly narrow, unforgiving bony canal in the human skull just to reach the face. Because bone doesn't expand, that swelling severely compresses the nerve right against the bone. This intense pressure essentially blocks the vital electrical signals from reaching the facial muscles. It's literally like cutting the wire to a speaker. The signals stop and the paralysis appears. Common triggers. So what triggers this whole chain reaction? The exact cause isn't always singular, but common viral culprits include the herpes simplex virus, the chickenpox virus, influenza, and yes, more recently, COVID-19. We also see heightened risk factors in specific populations: pregnancy, particularly in the third trimester, diabetes mellitus, severe daily stress, and weakened immune systems all act as potent triggers that can set this entire inflammatory process into motion. Section 3. Bell's palsy versus stroke. Moving right along to Section 3, we absolutely must address the single most urgent concern any patient or doctor has when a face suddenly droops. The crucial takeaway here is distinguishing Bell's palsy from a stroke. A stroke is a life-threatening medical emergency. Bell's palsy is not, so pay close attention to the physical differences. In Bell's palsy, the entire side of the face is affected, and crucially, forehead movement is lost. You cannot raise your eyebrow on that side. In a stroke, however, the forehead is typically spared. The patient can actually still wrinkle their forehead. Why? Because the upper face receives backup signals from both sides of the brain. Furthermore, a stroke very often brings arm or leg weakness and significant speech problems, whereas Bell's palsy is strictly isolated to the facial nerve with zero limb weakness. If you ever see these signs of a stroke, immediate medical evaluation is mandatory. Once a stroke is ruled out, we can all take a massive deep breath. Let's transition to Section 4, Diagnosis and Effective Treatments. Getting a diagnosis is largely clinical, meaning doctors are going to rely heavily on a detailed medical history and a very thorough neurological exam of the face. However, it's very much a diagnosis of exclusion. To be absolutely certain there isn't a tumor, a structural lesion, or some other underlying systemic issue causing that nerve compression, doctors might utilize advanced imaging, like an MRI or a CT scan. In some cases, they'll even use nerve conduction studies to measure the precise extent of the electrical damage to the nerve itself. When it comes to treatment, timing is absolutely everything. The golden rule is initiating corticosteroids, primarily prednisone, within 72 hours of symptom onset. This powerfully and quickly reduces the inflammation and nerve swelling inside that tight bony canal. Doctors might also prescribe antiviral drugs, like acyclovir, if they suspect a viral origin. But please hear me out on this next point because it is highly crucial. Eye protection is non-negotiable. Because the eyelid cannot close properly, the eye is constantly exposed to the air. Without artificial tears during the day, ointment at night, and an eye patch during sleep, the patient risks severe and permanent corneal venomage. Later, targeted physical therapy and facial exercises are fantastic for helping improve muscle tone and promoting healthy nerve recovery. And now for the most reassuring part of our explainer today, Section 5, Recovery and Long-Term Outlook. If you or a loved one are ever handed this diagnosis, I really want you to remember this. The prognosis is genuinely excellent. A massive majority, we're talking around 80% of patients, experience a complete, full recovery. The remaining 20% might have minor to moderate complications, but complete recovery is the absolute norm here. And that's especially true for children and those who present with milder symptoms right at the beginning. Recovery timeline. To help manage expectations, it's incredibly helpful to just understand the chronological journey. Symptoms typically peak and look their absolute worst within the first 48 to 72 hours. It's frightening for sure, but it's entirely normal. Then you just need a bit of patience. Improvement usually starts showing around the 2 to 3 week mark, and for most patients, full recovery is achieved within 3 to 6 months. Honestly, just knowing this timeline prevents so much unnecessary panic during those first few weeks of waiting. Synkinesis. Now, what's really interesting here is a specific uncommon complication worth noting called synkinesis. For our medical students, this is a fascinating phenomenon where the recovering nerve fibers actually crosswire as they grow back. This results in involuntary facial movements happening during voluntary ones. So, for example, a patient might go to smile and, due to those misrouted nerve signals, their eye inadvertently closes at the exact same time. It's a quirky yet profoundly interesting reminder of how delicate our nerve regeneration truly is. Prevention and protection. While there's no magic, guaranteed way to prevent Bell's palsy, we aren't entirely powerless here. Because viruses and inflammation are the primary culprits, keeping your immune system robust is your absolute best shield. You can empower yourself with everyday choices, maintain a healthy diet, make sure you're getting adequate sleep, engage in regular exercise, actively manage your daily stress, and for those with diabetes, keep your blood sugar in excellent control. Simply treating any other infections promptly also keeps your system from becoming overwhelmed. As we wrap up this explainer, I want to leave you with this remarkable thought. A bony canal, literally just mere millimeters wide inside our skull, dictates so much of our human experience. When a nerve swells inside it by just a fraction, it can drastically alter how we smile, how we taste our food, and how we present our innermost emotions to the world. It is a stunning reminder of the fragility and, quite frankly, the absolute wonder of human anatomy. So it makes you wonder, what other microscopic structures inside you are silently governing your daily life? Thank you so much for joining me. Keep learning, and I will see you in the next explainer.
Thank you for watching Science Force.